Welcome and thank you for attending the Black History Matters series presented by the National Abolition Hall of Fame and Museum. My name is Victoria Basulto and I am a current senior at Colgate University and also an intern for the National Abolition Hall of Fame and Museum. I will be facilitating the series of 28 presentations that will be released throughout the month of February 2021 and that you can view on our YouTube channel or on our website. I will now lead you through some introductory statements. The National Abolition Hall of Fame and Museum is located in Peterborough, New York, in the building that you can see on the screen where the inaugural meeting of the New York State Anti-Slavery Society was held in 1835. NAHOF's mission is as follows. The National Abolition Hall of Fame and Museum honors anti-slavery abolitionists, their work to end slavery and the legacy of that struggle, and strives to complete the second and ongoing abolition, the moral conviction to end racism. NAHOF has worked in coordination with the Garrett Smith Estate National Historic Landmark, which is also located in Peterborough, New York, to create the Black History Matters series. The following statement is the purpose of Black History Matters. NAHOF supports racial justice movements seeking to address racial inequality, given the resonance with NAHOF's mission to address the second and ongoing abolition to end racism. NAHOF believes a significant number of Americans do not understand the current racial justice protests due to their unfamiliarity with 4 centuries of Black American history because this history was either excluded or taught inadequately in schools. NAHOF knows that education is a powerful step towards ending racism, and that understanding the history of the enslavement and dehumanization of Black Americans provides critical context for the ongoing racial justice movement and the persistence of racism in America. Given NAHOF's commitment to strengthening knowledge of history as one route to confront racism, NAHOF will present Black History Matters, a series of crash courses covering some examples of neglected topics in Black American history throughout the month of February 2021. I'd like to now introduce our presenter, John C. Bowen. Dr. Bowen is a member of the Cabinet of Freedom with NAHOF and an OBGYN physician at Associates for Women's Medicine in Syracuse, New York. Dr. Bowen grew up in the Finger Lakes region of New York, attended medical school in Buffalo with a residency in Pittsburgh, Pennsylvania, and the United States Air Force in Cheyenne, Wyoming. Since 1992, Dr. Bowen has lived in Hamilton, New York. He states, I have always enjoyed studying the regional history wherever I have lived. The burned over region of New York is especially rich and inspirational. The nation would be immensely rewarded if it looked to the history of this region for guidance into the future. I'd like to now invite Dr. Bowen to begin his presentation on forced sterilizations.
In late July 1964, in the city of Rochester, New York, police were called to a block party and attempted to arrest an intoxicated Black man. He resisted, and the confrontation escalated to clubs and police dogs on one side and bottles and bricks on the other. Over the next 2 nights, the city burned. Governor Rockefeller called out the National Guard. By the time it ended, 204 stores had been looted or damaged, 350 people injured, and 5 were dead. Rochester at that time was a prosperous, cultured city. It was home to Kodak and Xerox, a world-class university and medical school, and the Eastman School of Music. How could this happen to such a cultured city? By the end of 1968, similar events were repeated in cities across the country. Malcolm X and Martin Luther King had been murdered. In the fall of 1968, Xerox sponsored a highly advertised primetime 7-part series on CBS titled Of Black America. I remember being riveted by the very first episode titled Black History, Lost, Stolen, or Strayed. It was hosted by Bill Cosby. In that hour, he challenged white America to look at the Black experience from the other side. With a measured but obvious outrage, he exposed the persistence of Jim Crow era stereotypes and indignities, then invisible to our mainstream lives. You have to be my age or older to remember that until that night, Bill Cosby was known for his friendly, safe, gentle humor. We played his records in my all-white 6th grade classroom. His comedy never hinted at Black outrage. He was one of the few Black performers on television at that time. That night, he took on an entirely new and instructive role for Americans. The program was a shocking wake-up call to America. It still is, and you can watch it now on YouTube. 50 years later, history is repeating itself, and we are again talking about Black history. I want to start my story here. It is not in America. To my knowledge, it does not involve any Black people, but it does illustrate conditions that were invisible to those on the inside, but glaringly obvious to those on the outside who bore the burden of pain. This is the Vienna General Hospital in the early 19th century. It was then and still is home to one of the oldest and most distinguished medical schools in Europe. At the time of this image, it housed some 2,000 patients. By 1840, the maternity division housed about 600 laboring women at a time. It served the poor and homeless women of Vienna in 2 large wards. The first ward was attended by medical students and their instructors, assisted by midwives. The second ward was served by midwives only. Laboring women were admitted to these 2 wards on alternating days. To those women, the timing and ward assignment made a potentially fatal difference. They knew their chances of leaving the hospital alive was far greater if they delivered in the second ward with the midwives and avoided the medical students. At that time, what was then called childbed fever, or what we would now call septic shock, was a leading cause of death in the charity maternity hospitals across Europe. It was especially high in Vienna. Maternal death rates in the first or teaching ward were 10 to 15%, but only 2% in the midwife's second ward. The poor of Vienna knew this, and many labored as long as possible in nearby alleys, waiting for the hours to pass until the second ward opened. On the inside, this was considered status quo until this man, Ignaz Semmelweis, was appointed assistant professor in 1846. He was appalled by the numbers and set out to finding the cause. This was decades before germ theory of disease. He considered and rejected a number of variables. To make a long story short, he followed the patients and medical students through a typical day. Medical students, after completing clinical rounds and deliveries, were expected to attend dissections and postmortem exams. His light bulb moment came after the death of an associate following an injury to the hand inflicted by a careless student during one such postmortem exam of a woman who had died of childbed fever. The assistant's ultimate death and postmortem exam were strikingly similar to that of the women in the ward. He suspected some particles were being carried on the hands of medical students from the cadavers to the laboring mothers. He instituted a program of hand washing and chlorine solution with dramatic results, as seen in this graph. Unfortunately for the women of Vienna, his work was ignored, and it was decades before germ theory was proposed and demonstrated by Pasteur and Lister, vindicating Dr. Semmelweis. We owe much to Semmelweis, but even more to those countless and nameless women who suffered in those charity wards, teaching the world the truth about childbed fever. Meanwhile, in America, this man, J. Marion Sims, was working on a different and devastating affliction, vesicovaginal fistula. There is no delicate way to describe this condition. It is a permanent breakdown of tissues separating the bladder and vagina. Urine then leaks continuously from the bladder through the vagina with resulting chronic irritation, painful blistering, ulceration of the skin, foul odor, and soiled clothing. These injured women were rejected by family and spouses and suffered from social isolation and even fatal depression. Fistulas were caused by sexual trauma, but more often resulted from obstructed and protracted labor. The impaction of the baby's head in the birth canal resulted in necrosis and sloughing of the surrounding tissues. The babies were invariably stillborn, and the mothers who survived suffered not only the loss of a child, but the pain and degradation I have mentioned above. Obstructed or prolonged labor was often the result of pelvic deformities or inadequate growth, which had occurred as a result of malnutrition and disease in the setting of poverty, neglect, and abuse, precisely the conditions of American slavery. Slave women in America bore a disproportionate burden of these injuries. Prior to the modern era, these fistulas were considered incurable. Even today, with antibiotics, anesthesia, proper instruments, and asepsis, they are considered challenging. In America, they are uncommon enough that few surgeons have the skill or experience to attempt a repair. In 1847, Dr. Sims was a popular physician with a small hospital behind his house in Montgomery, Alabama. It was there between 1845 and 1849 that he embarked on treating 12 slave women brought to him by their owners suffering from these debilitating fistulas. They were treated without the benefits of anesthesia and asepsis. 3 are known by name: Anarcha, Betsy, and Lucy. Each endured multiple attempts at repair. Lucy nearly died of sepsis, and Anarcha endured 30 procedures before Sims could declare success. Having perfected the tools and techniques still used today, Sims published his experiences and went on to fame in New York City and Europe. He founded the Women's Hospital in New York City, and a statue of him was erected in Bryant Park. Scholars still argue the ethics of his work, which is beyond the scope of this discussion. In the public eye, he has literally fallen from his pedestal, as seen in these images. His statue was moved from Bryant Park uptown across from the New York Academy of Medicine, and it was recently removed. There is talk of a new monument to his patients to be erected in its place. There are still areas in the world where women are plagued by these injuries, and doctors and midwives work heroically to both treat and prevent them. This is a New York Times column reporting one such clinic in Goma. We can argue about Sims, but we clearly owe much to those brave women, Anarcha, Betsy, and Lucy, and the nameless others who suffered the injuries of centuries of slavery and neglect, and whether willing or not, those years of repeated surgeries under Dr. Sims. The 19th century brought advances in science and industry. Along the road to progress were many wrong turns and dead ends. One with devastating consequences for Black people was the pseudoscience of eugenics. The eugenicists believed that human character was genetically determined. They borrowed the scientific sounding language of Darwin and Mendel to support and advance notions of racial and ethnic superiority. These notions were promoted by corporate philanthropists, including Kellogg, Gamble, and others. They in turn supported eugenic teaching at major universities, lending academic credence to those blatantly racist ideas. Harvard-trained biologist Charles Davenport, while teaching at the University of Chicago, founded a eugenics research station at Cold Spring Harbor, funded by the Carnegie Institute. Harvard and Princeton had eugenicists on faculty. They published papers purporting to show genetic links and therefore racial tendencies for laziness, immoral habits, criminality, feeble-mindedness, and high fecundity. The undesirable traits were being carried to American shores by recent immigrants from Southern and Eastern Europe. In 1923, Princeton psychology professor Carl Brigham published his dubious study of American intelligence, which reported higher scores for Northern Europeans and the lowest for African Americans. The eugenicists sponsored traveling educational shows at state and county fairs. In 1916, Madison Grant, anthropologist at the Museum of Natural History, published The Passing of the Great Race. It served to stoke the fears of Americans already alarmed by rising numbers of immigrants and northern movement of Blacks in the Great Migration, that superior Nordic stock was in danger of dilution through intermarriage with inferior races. In The Great Gatsby by F. Scott Fitzgerald, a sense of the time is illustrated by a brief speech by the odious character Tom Buchanan. He said, "Have you read The Rise of the Colored Empires?" he asked. "Well, it's a fine book, and everybody ought to read it. If we don't look out, the entire white race will be utterly submerged. It's all scientific stuff. It's been proved." In response to these growing fears of overpopulation by undesirables, lawmakers sought to control not only the immigration of foreigners, but their fertility once here. In 1907, Indiana was the first state to pass a sterilization law. In the interest of public health, superintendents of prisons and asylums were given authority to sterilize inmates. Other states soon followed. These laws were restricted by various court challenges until the Supreme Court opened the floodgates in 1927. The case of Buck versus Bell was a challenge to the state of Virginia sterilization laws. Justice Oliver Wendell Holmes Jr. sided with the state sterilization, writing, "It is better for all the world if instead of waiting to execute the offspring of degenerate crime or to let them starve for the imbecility, society can prevent those who are manifestly unfit for continuing their kind. 3 generations of imbeciles are enough." It is estimated that over 60,000 people were involuntarily sterilized across the country. Blacks suffered disproportionately. In the state of California, Black sterilizations were 4 times their population percentage. In North Carolina, 5,000 out of 8,000 sterilizations for mental deficiency were performed on Black women. Sterilization in the name of eugenics peaked in the 1930s and only declined following revelations of Nazi atrocities and the discrediting of so-called scientific underpinnings. Unfortunately, the decline of eugenics did not lead to a decline in sterilizations. New rationale replaced old. In the 1960s, new buzzwords were employed to rationalize forced sterilization. Concerns for overpopulation, illegitimacy, welfare dependency replaced the old overtly racist concerns, but had the same intended result. State lawmakers feigned budget concerns to try to pass new laws. Several states tried to pass laws requiring sterilization for women with children born out of wedlock in order to continue welfare benefits. It is important to stop here and define sterilization. Tubal ligation is a surgical removal of part or all of both fallopian tubes, resulting in permanent inability to conceive. The euphemism tying the tubes implies that the procedure is reversible simply by untying the tubes. That misconception, if not corrected or if abused, led to heartbreak and anger. In the 1960s, with federal funding, tubal sterilization became widely available and open to abuse. In 1965, Fannie Lou Hamer reported that 60% of Black women in Sunflower County, Mississippi, underwent postpartum sterilization without consent. Hamer herself had been subject to a hysterectomy without her consent. Both operations became known among the poor as Mississippi appendectomies due to their frequency. Similar concerns were expressed in New York and Los Angeles and across the country. During this time, Black women were threatened with loss of housing, welfare, and medical benefits for failing to consent to sterilizations, even in the absence of specific laws. The case of the Relf sisters brought the issue to national attention. In 1973, 14-year-old Minnie Lee Relf and 12-year-old sister Mary Alice Relf were living with their parents and 4 older siblings on public assistance in Montgomery, Alabama. Nurses from federally funded Montgomery Community Action Agency gained permission from the parents to admit the 2 sisters to the hospital for what they were told would be contraceptive injections. They came home sterilized. The Southern Poverty Law Center took the case to federal court. It was then revealed that an estimated 100,000 to 150,000 poor women a year were being sterilized with federal funds. Nearly half were Black. How many were threatened, coerced, or uninformed is unknown, but is clearly not zero. That case resulted in a prohibition of federal funds for involuntary sterilization. In 1973, a resident physician at LA County Hospital, Dr. Bernard Rosenfeld, reported some alarming numbers. LA County Hospital was one of the largest teaching hospitals in the country. In the 2 years prior to 1970, he noted a 742% increase in elective hysterectomies, 470% increase in elective tubal ligations, and 151% increase in post-delivery tubal ligations. The procedures were largely among Mexican-American women. He found evidence of coercion and little evidence of true informed consent. His report led to a suit by 10 Mexican-American women against the hospital. During the trial, a medical student testified that the chair of OBGYN told her that poor minority women in LA County were having too many babies. It was a strain on society, and the practice of sterilization was good for society. He also bragged of the federal money being generated by the practice. Even though the judge found for the defendant hospital, publicity brought by the trial generated demands for change. New federal guidelines required a 72-hour waiting period between consent and surgery, a ban on sterilization of women younger than 21, and a clear statement that welfare benefits were not tied to compliance. Subsequent changes increased the waiting period to 30 days. Challenges continue. In 2011, it was reported that 148 California prisoners were sterilized without consent, prompting a 2014 ban on prison sterilizations. So why does this history matter? It matters as long as Black women fear and distrust American medical care, and as long as disparities exist. This is the most recent cover of the Green Journal of the American College of OBGYN. I draw your attention to the cover articles. 5 of them address disparities in childbirth and other health outcomes. This cover is not unique or a token nod to Black History Month. Similar articles have appeared regularly in this and other journals for decades. The problems persist. They are getting attention. Black women disproportionately experience maternal mortality and morbidity. Preterm birth is 50% higher for Black women. Maternal mortality is 3 to 4 times higher. Black infant mortality is 2.3 times higher. Death from cervical cancer, which is now largely preventable, is higher for Black women. The COVID-19 pandemic has highlighted the discrepancy. Blacks account for 22.6% of deaths, but only 12% of the population. Despite this, vaccine reluctance is higher among Blacks than whites, but so is inability to receive the vaccine. This is why history matters. In the words of Ida B. Wells, the way to right wrongs is to shine the light of truth upon them. To earn trust and improve the care of our patients, my profession must acknowledge these historic wrongs, address our failings, seek truth, and proceed with honesty and respect. History can instruct us and inspire us to do better. Here's why I am optimistic. This is Dr. Laura Riley, a current leader in my specialty. She is chair of obstetrics and gynecology at Cornell Medical Center in New York City, and chair of the Immunization and Emergent Infections Work Group at the American College of OBGYN. She has spent her career improving the treatment of women with HIV, hepatitis, Ebola, and now COVID. In her job at Cornell, she directs the training of new specialists. In her work, there are no undesirables, no women considered unfit to procreate. Women are not bullied into agreeing to unnecessary or harmful surgeries. Innovative medicine does not require us to abuse our patients. Dr. Riley and I trained together under this man, our chairman, Dr. Terry Hayashi. That's him, second from right, in front at the University of Pittsburgh in the late 1980s. Dr. Riley is right behind him. I'm off on the other side somewhere. Dr. Hayashi was the son of Japanese immigrants to California. During the war, halfway through college at Berkeley, he was sent with thousands of others to one of the notorious California Japanese internment camps. After his release, he served in the US Army and then completed medical and specialty training. He was a leader in research and treatment of complications of pregnancy. He was at one time the president of the American Board of Obstetrics and Gynecology. He was a victim of history, but one of its heroes. To my knowledge, he never expressed anger. He was always cheerful, encouraging, and respectful with patients and students. His patients were grateful and uplifted rather than injured and angry. He was an excellent leader and a role model for many of us. His ethical behavior would easily stand today. I see Dr. Hayashi's spirit in these 2 future leaders, the authors of this recent Green Journal editorial. They have studied history and are living and making it now. I like the title of this editorial, Unlearning, Undoing, and Uplifting. May it be so. Thank you.
I'd like to thank Dr. Bowen for that educational presentation. If you're interested in learning more about this topic, Dr. Bowen has provided a reference list of sources with websites that you can explore to learn more. This reference list will be linked beneath the video in the video description. I will also invite you to fill out a quick survey linked also in that same video description, which will help us gather feedback about the specific topic and also provide us with valuable information that will help us in the formation of future presentations like this one. Should you have any questions regarding the presentation itself, Dr. Bowen has made his email available so that you may contact him with any questions or comments that you may have. Additionally, please do contact NAHOF if you have any questions or if you're interested in learning more about the organization and its work. NAHOF's contact information is available on the screen. Once again, I'd like to thank Dr. Bowen for providing a program for Black History Matters. I would also like to thank you, the audience, for joining us on this educational journey. Please remember that we will be releasing a new video each day this February of 2021. We hope we will see you at our next presentation. Thank you.